Anderson would be stopping by, and here she is. Good morning.
Good morning.
Tracy Anderson from the Central District Health Department joining us here for a little weekly chat. We're going to start off by talking a little bit about COVID boosters. Get ready, because there's a lot of information that I know you have, and it depends on your age group and where you are with the boosters and all of that.
Right. It may not be a terribly exciting topic, but it's important that we talk about it. Nearly everybody now can get a booster if they haven't had one. Generally, the boosters are 5 months after your primary series, which primary series is two shots of the mRNA, which is the Pfizer or Moderna or one J&J. And what we're asking people to do is call us, because it gets a little complicated. If you have an underlying health issue that makes you at high risk, you can actually get that booster at 3 months. If you're over 50, you actually can get 2 boosters. If you've had COVID, then we want you to wait 3 months, but then we want you to get a booster, because what we know is that having COVID provides some protection for about 3 months, but that you really need that booster at that 3-month interval, post symptoms or post onset of COVID. So it's kind of like a complicated thing, and we really, if you call us and you have your card with you and we know your vaccine history, we're going to be talking to you about getting a booster.
And you have everything available at your office, I mean, depending on the situation, right?
We do. We have the children doses, because just as a reminder, children who are 5 and older are eligible for a booster 5 months after the end of their original series. What we're looking for right now is in the middle of this month, June now, the FDA and the CDC will be looking at the vaccine availability COVID shots for 6 months to 4 years old. So we should be seeing something from them by the end of this month for all those parents who have been with those little ones, to determine whether or not they should be getting their shots. And that's going to be an important piece going into fall. The other thing we know is that we're probably going to need another booster in the fall. Omicron is sticking with us, and we've got this variant, this Omicron BA2, which is sticking with us. And actually, our positivity rate right now is about 50%. So half the people who are getting tested through a system that records it are being positive. That's not good. That means COVID's circulating. We know that if you have a home test, we want you to go ahead and use that home test. And if it's positive, know that you have COVID. We don't get very many false positive. If it's negative, we still have NOMI on site, at CDHD, Monday through Thursday till 3 o'clock in the afternoon, so that you can, if you're negative and you're feeling like you've got COVID, drive through and get what we call the PCR test, which is a 24-hour turnaround, which is really the standard for measuring if you have a negative home test. Come and get one of those just to be sure.
Tracy Anderson, our guest here this morning on KRGI. Just talking to you, I think about the journey that this has been, and there's still lots of moving parts. I mean, what you're talking about now and what's coming up in June, and it's like this big tree, and all of these different levels on where we've gone and where we are now, and it's still around.
So we learn more every day, literally every day, sometimes every hour, about what we should be doing. And so over the course of time, we started with a 2-week quarantine, I think it was, and we know that over time, and the science has been revealing to us what actually we need to do. We know that we're still in a period of a pandemic, and that the virus is going to respond to us through immunization. And so that's our key message, is that we can beat this virus. We can get back to eliminating it, or at least getting it, holding it at bay, far away, if we just get vaccinated.
Tracy Anderson from the Central District Health Department joining us here on KRGI, talking about COVID boosters. And it depends on your situation, what you've been through, But it's also just a simple phone call, and let's talk it out. What are you eligible for?
Right. We will tell you what the recommendations are, but you're also encouraged to call your healthcare provider and talk with them. If you have an underlying condition and you're like, should I get another booster now? Talk to your healthcare provider. We'll give you the shot, or you can get it at your healthcare provider's office as well.
Perfect. Anything else?
Nope. We're available Monday through Friday, 8 to 5, and on Fridays till 4:30.
Perfect. Central District Health Department here in Grand Island. Teresa Anderson joining us. Have a great rest of the week.
Thank you so much.
AM 1430 KRGI, 105.5 FM, 847 for your Wednesday, June 1st.